We're joined by Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute, and he's our specialist on foot and ankle conditions. Nice to have you here, Dr. Michaels.
Thank you, Angie.
Our question for you is, what is rheumatoid forefoot disorder?
Well, rheumatoid arthritis affects many millions of people throughout the United States, and it can cause problems in every joint system. Interestingly, though, this disorder causes problems in the forefoot of people's feet with rheumatoid arthritis, and this is a fairly normal-looking foot. I'd like to show you an X-ray, but it just wouldn't show up very well. I'll try to emulate how a rheumatoid forefoot disorder occurs. Usually, the big toe goes over like this, and it's kind of hard to do with the model, but all the toes just start to fall over like that, essentially dislocate out of the joint. And it's amazing that people don't have more pain with this, but sometimes eventually when it gets really severe they do, because these bones on the bottom start, the toes go up and over and the bones stick out the bottom of the foot. And that creates a lot of pain for these people and debilitation. Now, that's pretty much how, and rheumatoid arthritis is the disease that causes this. It causes weakening of the joints, weakening of the cartilage, and the forefoot, because there's so much pressure in this area, just essentially falls apart.
How is rheumatoid forefoot disorder treated?
Well, there are, depending on the severity of the disease, there are certain things that we do to accommodate this. And the first way we treat this is conservative treatment through accommodation, utilizing special orthotics or shoes that are custom-made, or orthopedic shoes that have custom insoles in them to help accommodate the bony deformity of the forefoot. And sometimes the deformity is so bad that really shoes just won't work, and people can't get around without having this problem fixed. So we have to sometimes do surgery on these, and that surgery is actually very successful, where we usually end up fusing the big toe together so it doesn't move and it's still straight and in alignment, and then straightening out the other toes, and unfortunately we still have to pin these. The nice thing about this now is that you can walk the day of surgery. Before you had to stay off your foot for 6 weeks to 3 months, and now you can basically have all this done, have it all fixed, have everything straightened, and walk that day. So the technology's changed. We've come a long way in developing better techniques that are less invasive and more effective. So that's pretty much how we treat these things. The majority of people can get away, though, with conservative treatment, special shoes, special inserts, and if the problem progresses, they may have to have surgery in the end.
All right, thanks so much, Dr. Michaels. Again, that was Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. Don't forget that you can ask your specialist questions on foot and ankle conditions only here on your4state.com.